If you want to learn more about a type of blood cancer which symptoms can be worse after drinking alcohol called Hodgkin's lymphoma, then you've come to the right place. My name's Dr. O'Donovan, and in this video together we're going to cover what Hodgkin's lymphoma is, potential symptoms, and finally when you should go and see your doctor. So first of all, what is a Hodgkin's lymphoma? Well, it's a type of blood cancer that affects the white blood cells which are called lymphocytes. It's also called a cancer of the lymphatic system, which is a network of vessels and glands spread throughout your body, and it's part of the immune system which helps to fight off infections in your body. Now, clear fluid called lymph flows through the lymphatic vessels and contains the infection-fighting white blood cells, which are called the lymphocytes. In Hodgkin's lymphoma, a particular type of lymphocyte called a B lymphocyte starts to multiply in an abnormal way, which begins to collect in certain parts of the lymphatic system, such as the lymph nodes, which you might notice as raised glands. Now, the affected lymphocytes lose their infection-fighting properties, making you potentially more vulnerable to infections. So now you know what it is, let's cover some potential signs and symptoms. Well, the most common symptom of Hodgkin's lymphoma is a painless swelling in the lymph node. This can be an area of the body such as the neck, armpit, or the groin. Now, it's really important to know that lymph nodes commonly swell if we have an infection, which is why when you might have a cold, you may notice swollen lymph nodes in places such as your neck, but these usually go back to normal over a couple of days. With lymphoma, the lymph nodes often grow slowly, and they may be there for months or years before they're noticed, but sometimes they can grow very quickly. Now, whilst I did mention that the swollen nodes don't hurt, some people do say that their lumps ache or painful, and for some people with Hodgkin's lymphoma, they're painful after drinking alcohol. Now, in addition to these symptoms, you may notice more other general symptoms such as heavy sweating, especially at night, high temperatures that come and go with no obvious cause, often overnight, losing a lot of weight despite not trying to, very itchy skin, which may be worse after drinking alcohol, cough or shortness of breath, tummy pain or vomiting after drinking alcohol. Now, some people have Hodgkin's lymphoma in their bone marrow when they're diagnosed. If you have this can cause the following symptoms. Firstly, shortness of breath and tiredness, and this is because of anemia from low red blood cell counts. Secondly, increased risk of infections because of a low white cell count. And finally, bleeding problems such as nosebleeds, very heavy periods, or a rash of tiny blood spots under the skin because of a low platelet count. Now, other symptoms will depend on where in your body the Hodgkin's lymphoma is. It's also important to note that swollen lymph nodes can press on the nerves and cause pain, causing swelling in arms or legs by blocking flow of the lymphatic fluid around the body, as well as cause yellowing of the skin and eyes, which is known as jaundice, by blocking the flow of bile from the liver. Now, whilst these latter symptoms are not common, they can happen, which is why I'm mentioning them. So when should you see your doctor? Now, please do remember that many of these symptoms that I've discussed in this video are very common and can be caused by different conditions that are not caused by cancer. Having them does not definitely mean you have Hodgkin's lymphoma, and if you've recently developed an infection, for example, swollen lymph nodes are common and they should go down over a few days to weeks. But it's important that if you do have any of the symptoms that we've discussed in this video, to get them checked out by your doctor. That's because if they are caused by cancer, finding it early may mean it's easier to treat. When you go to see your doctor, they're likely to ask you some specific questions about the symptoms that you're experiencing, carry out a physical exam where they might try to feel the lymph nodes in your neck or under your armpits, and potentially do some blood tests. Now, the only definitive way to confirm a diagnosis of Hodgkin's lymphoma is by carrying out a biopsy. This is a minor surgical procedure where a sample of affected lymph node tissue is removed and studied in a lab, and this would be done in the hospital. It's also important for me to mention that Hodgkin's lymphoma is not a common cancer, and that in the UK around 2,000 people are diagnosed with Hodgkin's lymphoma each year. This is compared to around 50,000 cases of something like lung cancer, just to put things into perspective. I've included lots more information on Hodgkin's lymphoma in the description box of the video from trusted sources, so please do look at these if you want to learn more, and please do leave a comment below if you'd like to share your own experiences or if you found this video helpful. Until next time, thanks for watching, and bye.